cardiopulmonary resuscitation is a life-saving technique that everyone should know. It helps people who are experiencing cardiac arrest, a condition where the heart suddenly stops beating. Cardiac arrest can happen to anyone, anywhere, and at any time, making it a critical emergency. This is a medical emergency that requires immediate attention. Without immediate help, the person can die within minutes due to lack of oxygen to the brain. CPR involves performing chest compressions and rescue breaths in a specific sequence. Chest compressions manually pump blood to the brain and vital organs, keeping them alive. Rescue breaths provide essential oxygen to the lungs, which is crucial for survival. By performing CPR, you can buy precious time until professional medical help arrives. This continuous blood flow increases the chances of survival and reduces the risk of brain damage. CPR is a simple yet powerful skill to learn, and it can be mastered by anyone. Regardless of age or background, anyone can be trained to perform it effectively. Recognizing the signs of a critically ill person is the first step in providing life-saving assistance. It's crucial to be aware of these signs so you can act quickly and effectively. Time is of the essence in emergencies, and knowing what to look for can make all the difference. Every second counts, and your prompt action can significantly impact the outcome. One of the most obvious signs is a loss of responsiveness. If someone is not reacting to their environment, it's a clear indication that something is seriously wrong. If someone is unconscious and not responding to your voice or touch, they need immediate medical attention. This lack of response can be due to various critical conditions, such as a stroke, heart attack, or severe injury. Another critical sign is the absence of breathing or the presence of gasping or abnormal breathing patterns. Difficulty in breathing can quickly escalate into a life-threatening situation. This indicates a severe respiratory problem that requires urgent care. Immediate intervention can prevent further complications and increase the chances of survival. Additionally, if someone has no pulse or a very weak pulse, it's a clear signal of a life-threatening situation. A weak or absent pulse often indicates cardiac arrest or severe shock. In any of these cases, it's essential to call emergency services immediately and be prepared to provide assistance. Stay calm, follow the dispatcher's instructions, and do what you can to help until professionals arrive. Remember, early recognition of these signs can be crucial in saving a life. Your awareness and quick response can make a significant difference in the outcome of a critical situation. Before rushing to help someone in need, it's paramount to prioritize safety. First and foremost, assess the scene for any potential hazards. Look out for things like traffic, fire, or electrical wires. If the environment is unsafe, do not put yourself at risk. Contact emergency services and wait for trained professionals to handle the situation. Once you've ensured the scene is safe, approach the victim cautiously. Check their responsiveness by gently tapping their shoulder and asking loudly, "Are you okay?" If there's no response, it's time to call for help. If someone else is present, ask them to call 911 while you begin assessing the victim. Remember, your safety is paramount. By taking the necessary precautions, you can provide assistance effectively while minimizing risks. Checking for cardiac arrest is the next critical step in determining if CPR is necessary. First, check for responsiveness by gently shaking the victim's shoulders and asking loudly, "Are you okay?" If there's no response, check for breathing by looking for chest movements. Look, listen, and feel for any signs of breathing for no more than 10 seconds. If the victim is not breathing or only gasping, it's time to call 911. If you're alone, call 911 yourself before starting CPR. Once you've determined that the victim is in cardiac arrest, it's crucial to begin CPR immediately. Section 5. CPR in action, step-by-step guide to chest compressions and rescue breaths. In this section, we will walk you through the essential steps to perform effective CPR, combining chest compressions and rescue breaths to save a life. Performing CPR involves a combination of chest compressions and rescue breaths. These actions help maintain blood flow and oxygenation to vital organs until professional help arrives. Start by positioning the victim on their back on a firm surface. Ensure the area is safe and clear of any obstacles that might hinder the process. Kneel beside their chest and locate the center of their breastbone. This is crucial for effective compressions. Place the heel of one hand on the center of the breastbone, just below the nipple line. This position helps you apply the right amount of pressure. Interlock your fingers with the other hand and keep your elbows straight. This technique ensures that your compressions are strong and effective. Position your shoulders directly over your hands. This alignment allows you to use your body weight to perform compressions efficiently. Begin chest compressions by pushing down hard and fast on the breastbone. Remember, the goal is to mimic the heart's pumping action. Compress the chest at least 2 inches deep and at a rate of 100 to 120 compressions per minute. This rate is critical to maintain blood flow. After 30 compressions, give 2 rescue breaths. This combination helps circulate oxygenated blood throughout the body. Tilt the victim's head back gently by lifting their chin. This action opens the airway, making it easier to deliver breaths. Pinch their nose closed and seal your mouth over theirs. This prevents air from escaping and ensures it goes into the lungs. Give 2 breaths, each lasting about 1 second, watching for chest rise. The chest rising indicates that air is entering the lungs. Continue cycles of 30 compressions and 2 breaths until help arrives or the victim shows signs of life. Consistency and persistence are key in these critical moments. Section 6. Effective CPR, ensuring quality compressions and breaths. Performing effective CPR is crucial for increasing the chances of survival. Ensure that your chest compressions are of adequate depth and rate. Push down hard and fast on the breastbone, compressing the chest at least 2 inches deep and at a rate of 100 to 120 compressions per minute. Allow the chest to recoil completely after each compression to allow the heart to refill with blood. When giving rescue breaths, ensure a proper seal over the victim's mouth and watch for chest rise. Avoid excessive ventilation as it can be detrimental. By focusing on the quality of compressions and breaths, you can optimize the effectiveness of CPR. The importance of defibrillation using an AED. Defibrillation is a crucial step in reviving someone experiencing cardiac arrest. An AED, or automated external defibrillator, is a device that delivers an electric shock to the heart. This shock can potentially restore a normal heart rhythm. AEDs are designed to be used by anyone, even without medical training. Most public places have AEDs readily available. When using an AED, follow the voice prompts and on-screen instructions carefully. The AED will analyze the victim's heart rhythm and advise whether a shock is needed. If a shock is advised, ensure that no one is touching the victim and deliver the shock by pressing the shock button. Early defibrillation combined with CPR significantly increases the chances of survival. CPR training. Empowering yourself to save lives. CPR training is an invaluable investment that empowers individuals with the skills and confidence to respond effectively during emergencies. Numerous organizations offer CPR certification courses, including the American Heart Association and the American Red Cross. Be prepared. CPR, a skill for life. Learning CPR is an essential life skill that can make a world of difference in emergencies. By understanding the steps involved in CPR and recognizing the signs of cardiac arrest, you can be better prepared to respond effectively. Remember to prioritize safety, check for responsiveness and breathing, and call 911 immediately if you suspect cardiac arrest. Effective CPR involves providing quality chest compressions and rescue breaths. Consider enrolling in a CPR certification course to gain the skills and confidence to perform CPR effectively. By being prepared and knowing CPR, you can potentially save a life and make a lasting impact.